putting dementia as a priority in health, in a way that we focus our attention in providing services through both inpatient and outpatient facilities. We are very proud that we have a first in Croatia, and I think only in Croatia, a daycare center for dementia patients, which is run since 2015 in collaboration with the city of Zagreb through a program called Program for Aging and Memory. This is a program that facilitates different services through an integrated approach for people living with dementia through a daycare center from 8 in the morning till 4 in the afternoon. These patients receive different formats of support and therapy. Our institution, the Psychiatric Hospital St. John, organizes activities through its daycare center for both patients and their families, as well as nursing at home professionals in sense of education and professional training. So we try to have a holistic approach where patient is at center, but we do use a multi-layer approach, understanding that the patient is not isolated, but rather needs support for himself, herself, their family, and also we need to understand that in order to have a sustainable approach, we need to train future professionals. So that's why we put a lot of effort in training nursing at home professionals. So our integrated approach, it consists of service integration from different profiles of professions, medical doctors, including psychiatrists, neurologists, occupational therapists, psychologists, technicians, nurses, as well as social workers. And all of them have their input in providing services for people living with dementia. The patients or people who are beneficiaries of the outpatient daycare center of our hospital have a program that consists of creative workshops, creative therapy, cognitive stimulation, aromatherapy, music therapy. We also have for them multi-sensor therapy, social games, as well as biopsychosocial approach in sense of curative interventions with both biological, pharmacological means, as well as psychotherapeutic means, and social interventions where our social workers help patients and their families deal with day-to-day issues and help them strengthen their position in the general society, both in sense of their status, health, and general well-being. The city of Zagreb has been supporting the St. John's Daycare outpatient center since 2015, and we've so far had a program that involves our beneficiaries, people living with dementia, their families, as well as professionals through a day program from 8 to 4. In the future, we plan to have program that lasts throughout the day. We would have coverage of transport for our patients and their families, and we would have even more intensive activities around training for nursing at home professionals. Our hospital includes both inpatient and outpatient facilities, so we communicate and collaborate very intensively with family health practitioners, where very often patients are first treated or identified through our inpatient facilities or our daycare center, and then we make a plan of their treatment or plan of their well-being along with other professionals such as family health doctors, social workers, or other professionals involved in the support for people living with dementia. Once patients, beneficiaries are diagnosed and their plan of treatment is made, then they go through the Integrated Services Center. The process of identification of patients and referral of patients is done in very close collaboration with associations working on dementia, family health practitioners, as well as medical and other professionals involved in the support for well-being for people living with dementia. Our center provides integrated services to beneficiaries, people living with dementia. Our therapeutic rehabilitative team consists of medical professionals of different profiles, internal medicine doctors, specialists, neurologists, psychiatrists. We also involve social workers, physical therapists, psychologists, and provide different services, so prevention, curative rehabilitation services, as well as some very specific interventions such as transcranial magnet stimulation, as well as neurofeedback for our patients.
Okay.